I am Farzana Choudhury. I'm a member of the faculty in the Department of Population and Public Health Sciences within the Keck School of Medicine. I am a primarily teaching faculty, so I teach. I teach a few classes in biostatistics, both at the undergraduate and graduate level. I was born and raised in Bangladesh, and I went to med school there. And after becoming a doctor, I worked with the government, and I was serving patients in different remote parts of Bangladesh. Those remote parts are heavily resource constrained. While I'm very proud of what we did with what we had, I understood that prevention and public health would be more impactful, because the way I saw how we impacted people's lives with health education, health promotion, vaccine drive, so on and so forth. So instead of taking care of one patient at a time, I thought public health would be more impactful in ameliorating the suffering of the people, and that's why I kind of started switching to public health. When I started studying public health, I found out, to me it seemed like epidemiology and biostatistics are two cornerstones in that. So let's say we want to answer a research question. We want answer, here's the question and here's the answer. In between the two, there is this whole research puzzle. Some of the pieces are from epidemiology, some of the pieces are from biostatistics. So I was trained here in USC in applied biostatistics and epidemiology. Then I did my PhD in epidemiology, and I was working as a biostatistician for a while. So it just made much more sense to me to teach biostatistics, so I can make sense, I can help students rather to make the connection between quantitative evidence and research question. In the undergrad class that we teach, we introduce the students, a mixed bunch of students, to the basic principles of biostatistics. There is another class I teach at the graduate level where we go into a little deeper on basic principles of biostatistics. We teach them more methods, parametric and non-parametric. And the third class I usually teach is a little different. It's a very applied, very practical, hands-on experience with real data. And in that course, students learn how to do data analysis, how to analyze the data and interpret it and write a report, focusing mostly on linear regression. My favorite part about teaching is the students. My students and how I interact with them. And I also understand that my main job is to make statistics interesting to them. All my students are interested to learn about research. But while your research question is intuitive, the method may not be that intuitive. We need to go through a scientific process, and then we have to gather quantitative evidence to back up our assertion or intuition. So my favorite part is to simplify the concepts enough for all my students to understand or connect the dots from question to quantitative evidence to interpretation to answering the question.